Hello. During this Man on the Move, I come to you with Dr. Ron Marconi, Medical Director of Case Management, and also Regina Sawyer, Case Management Director at Kaweah Delta. I'm tremendously pleased that our Board of Directors earlier this week approved the development of a chronic disease management clinic here at this site on the corner of Willis and Mineral King Streets. We are thrilled to have this program, and Dr. Marconi, perhaps you can describe the chronic disease management clinic.
Right. This clinic is not a walk-in clinic. It's a clinic that has a purpose of dealing with chronic diseases. And so the first attempt is going to be at congestive heart failure. That's a disease where the hospital has to deal with coordination of care, needs to work with coordinating the care that's already been done in the hospital and then enter into the community. Along with the coordination of care is going to be an attempt to do some equity of care. Not all care is equally available to people in the community, and so that's going to be involved here also. There's going to be education components. There's going to be an attempt to make a full-service medical care program for an illness such as congestive heart failure, which has a very large education component. It has a complex medical component and a large amount of ongoing testing that may be associated to see how they do. So that's the main purpose of the clinic.
Sounds like the real intent is to keep the patient as well as they possibly can be with some proper guidance from the leadership of the clinic.
Right. Out of the emergency room, back here, not to be competitive with the medical community. We're here to support the medical community. This is going to be a top-rate clinic that will only deal with chronic illnesses.
Excellent. I've heard that coordination of care phrase that you used,
Yep.
and I think that's a key idea. Thank you. Regina, tell us about the timeline for developing this initially and over time.
Sure. We plan to open our clinic in May, and we're going to initially start with heart failure and other cardiac conditions. We're also going to relocate our diabetes center in this location so we can utilize those services as well as infusion services. So all of that will be available initially. We also have comprehensive laboratory services, x-ray, all cardiac services, including stress testing and echoes will be available on this site. So that's very important for the patient to get an all-inclusive visit when they come into our clinic. Over time, we're going to add more diseases such as COPD, pneumonia, and other chronic conditions that we see are a challenge for our patients in our community.
Excellent. Well, there you have it from Dr. Marconi and Regina Sawyer, a wonderful summary in brief of the beginning of a chronic disease management clinic, which over the next 5 years will continue to be responsive to community needs to help our patients stay as well as possible. Thank you for joining us for this Man on the Move.